हेलो गुड मॉर्निंग, मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। विच ऑफ द फॉलोइंग इज अ डिराइव्ड एंड कैलकुलेटेड वैल्यू इन arterial blood gas analysis? PHCO2, PCO2 and bicarbonate. Here the bicarbonate is the answer. Because the bicarbonate concentration is calculated or derived from PaCO2 and pH using the Henderson-Hasbach equation. What is the equation? Henderson-Hasbach PCO2 plus H2O is equal to H2CO3 with the reversible relation and SCO3 ion. If an increase in SCO3 occurs with either metabolic alkalosis or respiratory acidosis, a decrease in SCO3 occurs in metabolic acidosis and respiratory alkalosis. Next question. Seizures are seen in what percentage of RTA patients with brain contusion or loss of consciousness? Development of seizure in 70%, development of seizure 45, 75, or no relation between trauma and seizures. Here the answer is the development of seizure 17% because the convulsion are uncommon immediately after a TBI, but in a period of tonic extensor posturing or a few chronic movement of the limbs just after the movements of impact can occur. It has been estimated that 17% of individuals with brain contusion, subdural hematoma, or prolonged LOC will develop seizure disorder. Penetrating injuries have a much higher rate of subsequent epilepsy. Post-headed injury, phenytoin is used for the treatment of seizures. Next question. Criterion that differentiate exudate and transudate pleural effusion. Low protein in pleural effusion, high protein in pleural fluid, low sugar in pleural fluid, high sugar in pleural fluid. Here the answer is the high protein in pleural fluid because the transudate to pleural effusion occurs due to the imbalance between what the hydrostatic and oncotic pressure that causes increase in pleural fluid in intestinal space. And exudative pleural effusion occurs due to the inflammation of infection, example bacterial pneumonia, malignancy or infection. Ladd criteria is used to differentiate transudative and exudative pleural effusion or hydrothorax. High protein in the pleural fluid indicates it is in exudative type of pleural effusion. What is the Ladd criteria? First, pleural fluid protein serum level more than 0.5, exudate fibrin elevated. If a pleural fluid LDH or serum level LDH more than 0.6, exudate fibrin here elevated. Pleural fluid LDH more than 2 or third of the upper limit in the serum. At least one out of the above condition what I am told is fulfilled for the exudate, and misidentified 25% of transudate as exudate. So high protein pleural fluid is the answer. Next question. A male patient with infertility present to disorder comprising the triad of situs inversus, chronic sinusitis, and bronchiectasis. Which of the following is the correct diagnosis? Category syndrome, cystic fibrosis, mucosidiosis, Klinefelter syndrome. And the answer is the Cartesian syndrome because the Cartesian syndrome is a rare clinically mortality disorder mainly affected the cilia in the respiratory tract and a fallopian tube. It is the autosomal recessive disorder and occurs due to the defect in the dynein protein. Patient usually present with otitis media, chronic recurrent rhinosinusitis, pneumonia, and bronchiectasis caused by the Pseudomonas infection. What is the clinical triad in Cartesian syndrome? Situs inversus, chronic sinusitis, and bronchiectasis. This is the important point. Other features include like the infertility in males and sub-infertility in females, and the telecanthus. Other features also included in Cartesian syndrome. Next question. A 70-year-old male patient present with a complaint of dysphagia, particularly for solid, which has been progressively worse over the past few months. Additionally, he has experienced significant weight loss and cachexia over the same period. Which of the following diagnostic choice is best for the patient? UGIE, manometry, barium cello, and barium meal follow through. Here the UGIE the best answer, because the patient with present a dysphagia more for solid than liquid and cachexia likely indicated carcinoma esophagus. upper GI endoscopy perform करेंगे. If the patient visualize and identify the tumors and also obtain a tissue biopsy to confirm the diagnosis, or through the endoscopy inspection of the larynx, trachea, bronchi is conducted as the population at risk has a high chances of the carcinoma of the lung, head and neck region. CT scan, yes, of the chest and abdomen is used to detect the extent of the tumor spread to the mediastinum and para-aortic lymph nodes. Here summarize the question. The upper GI endoscopy is the best investigation, UGI upper GI endoscopy, in the carcinoma esophagus to identify and obtain a tissue biopsy to diagnose the disease. If the CT scan is used to study the extent of tumor spread in the chest and abdomen. Next question. A patient had a feature of resting tumors, bradykinesis, and postural stability. He became bedridden and died due to the respiratory failure. A brain biopsy is likely to show which of the following: Lewy body, Hirano bodies, Guranary body, Negri body. Here the Lewy body is the best answer, because the patient at the resting tumors, bradykinesis, and postural stability indicates a diagnosis of what? Parkinson disease, not syndrome. Parkinson disease. Here the symptom of the Parkinson disease. The brain biopsy of Parkinson patient shows what? The Lewy body. Lewy body is a what? Eosinophilic cytoplasmic inclusion that contains both neurofilament and alpha synuclein. What is the hallmark feature of Parkinson disease? Degeneration of dopaminergic neurons of the substantia nigra or pars compacta, reduced striatal dopamine, intraneuronal proteinaceous inclusion, as known as the Lewis body and Lewis neuritis. And Hirano bodies are absorbed in ALS and Parkinsonism dementia complex, and Guaranary bodies are found in cell infected with smallpox or vaccinaria virus, and Negri's bodies are eosinophilic cytoplasm inclusion in brain neurons that are composed of rabies virus protein and viral RNA. That's all, and keep revising. Thank you.